The voices of two South Africans telling us how difficult it is being stuck inside China, particularly in the vulnerable areas as this virus starts to continue to spread. And we've seen it go to other parts of the world, parts of Europe and North America, where we return now to New York, where Sherwin has been watching the story. And Sherwin, you're in New York. This is the home of the United Nations. I know that the UN's Emergency Health Committee met last week. What is the status? What is happening? How are they dealing with this pandemic? What have they declared it?
Right, so the World Health Organization, which essentially is the health agency of the United Nations, did meet late last week, Peter, and they've decided not to declare the coronavirus a public health emergency. I'm just going to quote from WHO Director General Tedros Ghebreyesus, who spoke late last week. As of yesterday, which is Friday, the emergency committee was divided over whether the outbreak of coronavirus represents a public health emergency. Make no mistake, he says this is, though, an emergency in China, but has not yet become a global health emergency. If you look at some of the statistics, Peter, you are correct that it's spread around the world. There are 5 cases reported in the United States, particularly on the west and central parts of the country: Arizona, Washington State, Chicago, Orange County in California, and Los Angeles County. So very much, I think, where you would see sort of an entry point from Asia into the United States through Washington State and California State, certainly on the West Coast. But health authorities in the United States, for example, I'm just going to quote from the Los Angeles County Health Department: there is no immediate threat to the general public. They say no special precautions are required. And if you look at the statistics, some 80 people, at least 80 people have died from this virus, all in China. Of the 2,700, 800 cases reported so far, the majority of those are in Wuhan, in the Hebei province of China. So very much concentrated still in China. We understand that officials from the World Health Organization are traveling there to consult with Chinese counterparts and colleagues as to how best to arrest this virus, Peter.
All right. What do we know about the 5 people that are infected and their state of health?
Well, a lot of the virus outside of China has been quite mild. So they are quarantined in health facilities. They are monitored very closely. They are given certain medications to get them back on their feet. So there's no fear, certainly from my read of the situation, that people are in imminent danger of death. A number of the cases reported here have been caught early, and with early detection, prevention is the cure, one imagines.
All right, and no state of panic as yet in the United States?
Absolutely not. No, certainly not as much as when a couple of Ebola cases, Peter, were identified in the United States during that major outbreak in West Africa that also spread to different parts of the world. That was sort of an all-hands-on-deck approach from certainly the CDC in Atlanta and various health departments across the country. What we are seeing here is a very measured response. Authorities feel they have the resources in place to deal with various outbreaks if those were to happen. But weeks into this outbreak globally, we've only seen 5 cases in the United States. And to put that into some perspective, this is a country of 380 million people.
All right, Sherwin, we're going to have to leave it there. Thanks very much indeed for that update. That's our US correspondent in New York, Sherwin Bryce-Pease, giving us an update. So 5 people confirmed to have the virus in the United States, 81 dead around the world, mostly in China, a virus that's spread to other parts of the world, including Europe and Asia. And we'll keep a track of that story for you.